Thank you very much and good afternoon. So we're here this afternoon to share the latest updates on our COVID-19 public health response. And I want to start by just acknowledging, as you might have seen earlier today, I announced changes to the Provincial Health Officer Order, which lifts the capacity limits at some of the organized events and gatherings with the implementation of the vaccination card and the checking of full vaccine status. So effective October 25th, one day after the full vaccine requirement comes into effect, we'll be able to increase to 100 capacity at indoor sporting events, indoor concerts, theaters, movie theaters, dance and symphony events, and some of the great arts and sports that we've been missing, as well as indoor organized events such as weddings, funeral receptions, and parties. I will, as well, we're going to be lifting that restriction, the requirement that everybody be seated at restaurants and pubs to allow a little bit more freedom of movement with the fact that everybody in those situations will be fully vaccinated. I will remind people, of course, that the other public health restrictions remain in place, including the indoor mask requirement when you're moving about. And these changes are applicable where proof of vaccine status is being checked and also where there are no regional health orders in place. And as you know, we've been monitoring that very carefully, and the regional orders are in place in some areas in Northern Health, Interior Health, and Fraser East, for example. So we're hoping to leverage the benefits of the vaccine card, and this is an important first step of that, and we'll be monitoring carefully and looking at whether we can take away additional restrictions depending on how things evolve over the next few weeks. In addition to the changes this morning, I want to share today our first school situation report. As we talked about a number of weeks ago, we've been trying to collate information in a more systematic way than we were able to do last year, and to be able to provide that information on a monthly basis so people have a good sense of what's happening in our schools. So this first report looks at the impact of COVID-19 on children and K-12 schools. It will be posted after the briefing today on the BC CDC website, and there's quite a bit more detail in it, so I encourage people to go there. And we will have additional reports released on a monthly basis. And as we are able to collect more information and get the systems in place to put this together, we'll have more information available as well. But first off, I wanted to start with looking at presenting the update of the age-based cases that we've seen. So this is the rate of in the 12 to 17-year-olds, particularly in the areas where their vaccination is high in that age group. One of the things that we want to do is look at those case rates and see the impact of where people are being infected. So we look at the age, we look at where the geography, as well as what's happening in the communities around those schools. And as we can see across BC, we've seen a decrease in young children and the school-age children as well across BC, but particularly this has been pronounced in Interior Health and Northern Health, where we saw the biggest increases. And certainly at the beginning of the school year, it was a dramatic increase in Interior Health that we were seeing primarily, again, related to the increase we were seeing in community across Interior Health that started in August. And that's now taking a downturn. Northern Health continues to remain higher than in other parts of the province, but we know that that is a reflection, again, of what we are seeing in communities across the north, and reasons why we brought in additional measures in much of the north last week. We do see, however, that those rates remain stable in the vaccinated population and the 12 to 17-year-olds, and they remain low in the areas where we have very high immunization rates in families and communities, particularly Vancouver Coastal and Island Health. So this gives you a good sense of where we are now. This tells the picture a little bit of what we're seeing and why we're seeing this. So what it shows in the light blue line is the percent positivity, the 7-day moving average of daily test positivity in the different age groups. And the darker blue line tells you the rate of tests. So this is a summary of some of the information I presented a few weeks ago, which showed that we had a dramatic increase in number of tests being done, particularly in school-age kids, but also in younger children 0 to 4. And this reflects people coming together again and going back to school, but it also reflects that we're starting to see other respiratory viruses causing infection in children and in communities, and that's adenoviruses, some enteroviruses that cause respiratory infections, a little bit of parainfluenza. We have not yet seen a lot of influenza, but we did have our first influenza positive in quite some time just this week. So we'll be carefully watching that. But what this shows us is that across the board we had an increase in rates of testing in this age group, and we had a steady decrease in the percent positivity. So it is telling us that we're looking for this in younger people, and we're finding it, and those rates have now come down. One of the other things, of course, we're very concerned about is, are we seeing severe illness in children? And we've been watching what's happened in other countries, particularly the US, where there was a dramatic increase in hospitalization in school-age children. We have not, thankfully, seen that here in BC, but we will continue to watch. We have seen very few children admitted to hospital, thankfully. In the past week, we have had one admission So we've had 5 new admissions in the 0 to 4 age group, 1 in the 5 to 11 age group, and 1 person 12 to 17 who were admitted to hospital. And there were no admissions in the school-age children to ICU in the past week. So that's important for us to watch as well. Again, in the areas where we have children who are immunized, the 12 to 17 age group, we can see that hospitalization is much, much less common, even though it's rare across the board, less common in youth who have at least 1 dose of vaccine compared to unvaccinated young people. Again, this is something that is important for us to consider now that we know that Pfizer has submitted the complete package to Health Canada for approval in younger children. And it reminds us again the importance of protection of children from a transmission, not only to prevent hospitalization, but to prevent that transmission of disease in these important settings. Finally, in the report, what you'll see is a more in-depth analysis of the clusters we are seeing in schools, particularly in the interior health region, where we had those high rates of transmission in the community, and we saw the most increase in child age infections. And so there were 80 clusters where COVID transmission may have occurred in the school setting during the first 5 weeks of the school year this year. So a total of 314 cases were linked to these clusters, which is about a quarter of the cases among that age group of children in the region. And a cluster, as we've defined it, is 2 or more cases within a 14 period of time. And so there were 12%, 46 schools in the interior health region where a cluster was reported. And importantly, we look at how much transmission is happening, because we want to compare that this year to what we were seeing in the last school year. And the data that is in the report that you can see from last year, on average we had, or the median number of people that were involved in in a cluster was 1 to 2 last year, and we are seeing a slight increase this year where the median number is 3. But it is still remains small, and across the board in the province, less than 1/3 of schools have had a cluster. And I think that's important. We can see that these are always stressful situations, and we know there was a lot of anxiety going back into school this year, and it's important for us to provide this information as best we can so people know the situation that's happening. So what we can see is that across the board, the number of schools affected have been about 1/3, which is about the same as what we saw last year. And there is slightly increased transmission, but it's mostly controlled. And again, most of the infections, the source of infection for school-age children is outside of the classroom. Obviously, we need to continue to watch this, and my colleagues across the province are working with our schools, with our educators, with the teams to make sure that we can get as much information as quickly as possible to parents. I will say again that we know it takes time to do those case investigations, and that parents are often the first to know if their child is ill. And so we need to work together to make sure we're taking all of those precautions so that we can keep our schools active and functioning and all the important things for children in the school system this year. The other, of course, things that we've been in terms of vaccines that we've been working on this week, we have a few encouraging updates. We've been monitoring, again, the outbreaks and cases in long-term care facilities as we've started to roll out the booster doses in those settings. Again, we see that they reflect the community rates of transmission. The measures that we've put in place, including prioritizing that third dose for residents, just as we did with COVID vaccines the first time around, to ensure that our most vulnerable have that maximum protection. And we've started with those facilities where there is a risk, where we've seen a person, either a staff person or a resident as a case, and also prioritize those facilities that started early and had the reduced interval to make sure that we can provide protection as quickly as possible. And our teams are working hard to get those doses into arms as soon as possible. I will say the other part that we have around our long-term care is we in a week now since the requirement for workers in health in long-term care and assisted living to be vaccinated, and that is going very well. It's that extra layer of protection, but we've also recognized the importance of upping the infection control precautions that are being taken even with that fully vaccinated population, knowing that everybody needs to take these measures right now so that our seniors and elders in care can be as protected as possible. Having said that, we are also looking at where other booster doses might be needed in our community for those who are most vulnerable, and we'll have more to say about that later on this week. In addition to encouraging everyone to get their COVID-19 vaccine, today marks the official public launch of our influenza immunization program. And we know last winter, despite the challenges with COVID-19, we had very few, actually no active cases of influenza from outside. We did have a few influenza swabs that tested positive, but they were mostly from young people who received the active vaccine. So that is good. And partly that was because of our high level of immunization, as well as the fact there were many public health restrictions in place through that winter season, which limited our ability to move around and spread, and particularly international travel restrictions, which we know is one of the ways influenza spreads around the world. This year is a different situation. Not only are we needing to take precautions because of how easy this new Delta strain spreads, but the BC vaccine card also allows us to spend more time with others, and we know that some of the international travel is coming back. I am strongly encouraging everyone in BC this year to be immunized against influenza as a way of protecting yourself from this other serious respiratory infection, but also reducing the respiratory transmission risk in our community so that we are taking that burden off our healthcare system as well. And this year, the influenza vaccine is available for free for anybody over 6 months of age for whom it's recommended, but particularly people who have underlying health conditions or who work with and care for people who have compromised immune systems or underlying health conditions. It's most important that you protect yourself and them from influenza as well this year. As anticipated, we've seen once again the recent announcement from the United States that when it comes to international acceptance of what's considered fully immunized, the situation continues to evolve and quite quickly. But I was very pleased to see the U.S. is now in step in recognizing the approach we've taken here in Canada, and is accepting all of the mixed doses that we've had here, including AstraZeneca and different mRNA doses. And I think it's a credit to the work that we've done here in Canada to show the effectiveness of these vaccine combinations. And I'm just very pleased. That means people in BC who are fully immunized will now be able to travel to our neighbour in the south as well. It is further evidence, of course, that all of the available vaccines approved for use here in Canada are safe and highly effective, no matter what combination you've received. So I think that's very encouraging news that that's starting to be recognized more internationally. The one other thing I wanted to address today is questions that I continue to get about post-infection immunity. And really, the bottom line is from scientists around the world that there is no consensus yet, as we're learning about this virus, on the strength and durability of post-infection immunity. And there's no good way to measure that strength and durability over time. Yes, we do absolutely recognize that most people have some immunity from for some period of time after being infected. And early on, when we had limited supplies of vaccine, we didn't prioritize people who had a recent infection within 3 months because we knew that most of them had some degree of protection against this virus. But we've also seen studies that have shown that that protection can be very variable depending on the type of infection you had, depending on your own strength of your immune system. And there have been some small studies that have showed that some people do have very long and durable protection post-infection. However, it's impossible to prove how strong and how long this protection lasts in individuals over time. And because we cannot know that, and we do see people having repeated infections that can lead to serious illness and hospitalization, that we are erring on the side of the protection with the known amount of antigen that is in a vaccine. So that gives the most prudent response to be able to protect people with a known amount, with a known period of time. So again, for people who have had a previous COVID infection, it is still recommended that you receive a full dose, a full series of any of the vaccines that are approved for use here in Canada. So every week we do stand here before you to provide you with the latest updates, the latest research and information that we have, and every week we have lots to share. This is because we are seeing that this pandemic continues to evolve. And we are trying to evolve as best we can to support the needs that people have so that we can do the things that we need to do to protect our friends, our colleagues, our neighbors, our loved ones, and continue to try and live our lives within the context of the pandemic that we are managing right now. Here in BC, people have faced this storm with compassion and determination. And even though we know that things are not as where we want them to be right now, we know that the vaccine is giving us good, strong protection, and we can see that in the results. Then we can see that in our ability to get back to doing those things we love with the other people who are also protected. And we need to ensure that we're working for each other and doing our part that benefits everybody. So thank you very much for that, and I'll turn it over to Minister Dix.
Thank you very much, Dr. Henry. Throughout this pandemic, all of us have been taking steps to keep our community safe. And this fall, there's another step everyone can take to stay healthy, protect our healthcare system, support healthcare workers, support one another. And that step is to book an appointment to get an influenza vaccine. I'm happy to share that every person over 6 months of age has the option to get a flu vaccine free of charge. That reflects our determination to have the largest influenza flu vaccine effort in British Columbia's history. 2 years ago, and in previous years, British Columbia received about 1.5 million doses of vaccine. This year, the number will be 2.4 million. That's 200,000 more than last year when we got extra doses. And that reflects the need right now, to ensure that we are protected and as protected as possible as a community from respiratory illness this fall. But the challenge of COVID-19 is significant, and we want to reduce other challenges the healthcare system faces. That's important, but as well, we want you to stay healthy and to stay fit throughout this winter, coming fall, winter, and spring. It's more important to take these steps than ever. You can get your flu shot by contacting your local pharmacy, your primary care provider, through a public health unit, or through other health facilities. Last year, pharmacies did a record number of flu shots. For the first time, I believe the majority of influenza shots took place in community pharmacy last year. I think it was in the neighborhood of 1.1 million of the doses that we delivered last year, which was roughly 1.5, 1.6 million. And I expect that to be the same this year. I believe 800,000 doses are out with pharmacy right now and out in the community. And so it's time to book. It's time to get your shots. We know that vaccines, flu vaccines and COVID-19 vaccines, provide protection to the wider community. And that's why as well, and this has been at the foundation of our strategy. As you know, yesterday, because we provide this information regularly, 88% of people in critical care due to COVID-19 were people who are not fully vaccinated. This represents a small share of the overall population. It's over 16%. That's how this group is. But the dramatic share of critical care cases and of hospitalizations. The data shows that unvaccinated people are 40 times more likely to end up hospitalized due to COVID-19 than people who are vaccinated. 40 times. The impact of the number of people in our hospitals with COVID-19, the overwhelming majority of whom are unvaccinated, can be seen with the number of people needing to be transferred, for example, out of Northern Health right now. Since September the 5th, a total of 65 patients in critical condition have been transferred to other regions of the province. That continues to test our healthcare system everywhere. It demonstrates how we're all in for one another during this pandemic, but it also shows the need for all of us now to get vaccinated against COVID-19 and join the 89.2% of people who've received their first dose immunization over 12 from COVID-19, and to get vaccinated a second, join the almost 84% of people who are fully vaccinated, and to do that as soon as possible. On Tuesdays, we report on the continued postponement of some surgeries in some locations in BC. Each and every person who has their surgery postponed will be called to rebook their surgery. That has always been our commitment, and will continue to be a commitment that is fulfilled. Your surgery is important, and we will get you your surgery. The news from Interior Health that it has started to call patients to rebook their surgeries is exactly what it should be. Encouraging and welcome news that restores us all, and for patients a phone call that reduces unwanted anxiety and allows considerations of the next step in their health progress and experience. I want to report that on the surgical postponements over the past 2 weeks, that's October 3rd to October 16th. During that reporting period, health authorities postponed 556 non-urgent elective surgeries or scheduled surgeries. That's 15 in Fraser Health, 177 in Northern Health, that's 107, 127 in Vancouver Coastal Health, 307 in Vancouver Island Health. No surgeries were postponed in Interior Health or the Provincial Health Services Authority. From September 5th to October 16th, there have been 1,940 surgical postponements over that period as we add the numbers up through week onto week of reporting. That said, surgeries are continuing across the province. From September 19th to October 2nd, health authorities report 12,084 surgeries were completed. This reporting period would be less. It's less than we would ordinarily see in the period, as it includes the health authorities' observance of the National Day for Truth and Reconciliation. For those who deliver surgeries to do the work we're counting on them to do, we know they're counting on us to do the essential work to stop the spread. Get vaccinated, stay safe. When it comes to contact tracing in BC, there are now 1,522 contact tracing staff in place across 5 regional health authorities and the Provincial Health Services Authority as of October 18th. 83 more were added over the past week. That's 507 in Fraser Health, 204 in Interior Health, 208 in Northern Health, 205 in Vancouver Coastal Health, 143 in Vancouver Island Health, and 255 in the Provincial Health Services Authority. Getting through the pandemic has always been a team effort, and all of those individuals, all of them, have demonstrated their commitment. I wanted and are doing, I think, remarkable work in supporting people at a difficult moment, especially when their COVID test comes back positive. I want to report on a couple of other issues to you. First is hospital bed occupancy, to give you a sense of where we are. On our base occupancy right now, base bed occupancy rate is 95.1%. That means there are 449 vacant base beds on a total of 9,229 base beds. Our total surge bed occupancy, as you recall, the total surge beds is 2,353. Our vacant surge beds are 1,856. So roughly 9,280, roughly is the current total census across BC hospitals. In terms of critical care, as you recall, we have 510 total base beds in critical care across British Columbia. At present, 55 of those base beds are vacant. We have added 218 total surge beds to critical care in BC. 183 of those are vacant. And so if you look at that, it's our total census in terms of critical care, all things, this is COVID-19 and everything else, is 490 as of yesterday evening. And I wanted to report on one last thing, and it's an important thing that's coming up. Dr. Henry talked about the significant effort to vaccinate staff in long-term care and in assisted living. As we reported last week, 96% of staff had been at least partially vaccinated in long-term care, 97% in assisted living. We have the preliminary numbers for health authority healthcare workers across the system. These are excluding long-term care and assisted living staff. And if you look across the system, so this is based on a unique count of 129,924. Of the number, 121,048 are fully vaccinated. That's 93%. 3,364 are partially vaccinated. And 4%, or 5,512, are not vaccinated. So we're hopeful, of course, that people will move to get vaccinated and comply with the upcoming order with respect to ensuring that everybody in our healthcare system, everywhere in our hospital system, all of our direct care staff working for health authorities are vaccinated. Those are the numbers, those are the relevant numbers for them. If you look at it by health authority, just to give you a sense, and I'll just give you the not vaccinated, I'm sure we'll provide this information to all of you as well. By health authorities, it's 2% not vaccinated in Fraser Health, 7% not vaccinated in Interior Health, 6% not vaccinated in Northern Health, 3% in the Provincial Health Services Authority, 3% in Vancouver Coastal Health, and 5% in the Vancouver Island Health Authority. So essentially what we're seeing, that 6% mark, is a very similar number to what we saw in assisted living and in long-term care. I want to thank each and every one of us who's taken that option, who have joined the path of getting vaccinated, of reducing transmission, and of getting back to the things that we love to do together. I think the effort by everybody in the healthcare system is all in right now, all in for regions that are struggling more with COVID-19 transmission right now, all in for everybody. And I ask everybody to do everything they can, especially when you're asked to get vaccinated, and that's everybody, right now except those under 12, and to encourage and support one another as we deal with the COVID-19 pandemic in BC. We're happy to take your questions.